My name is Steph Skinner. Today is the 19th of May 2014. This video is going to cover both a MICA handover and a hospital notification. First, I'll start with my MICA handover. Hi, I'm Steph from Seaford Branch, and this is Michael Creed. He is a 56-year-old male who lives alone and is independent with activities of daily living. Michael called AV at approximately 13:30 hours post a syncope episode, woke with pain radiating down his left arm accompanied with nausea. On arrival, Michael was slumped over, clutching his left arm in the hallway. This was noted to be his position of comfort. The pain in this arm was 5 out of 10 upon regaining consciousness, accompanied by nausea, and he had cyanosed lips. PT states loss of consciousness for unknown time. He is urinary incontinent only, and we noticed that he had a hematoma on the back posterior of his head. Michael has a past history of hypertension, hyperlipidemia, non-insulin dependent diabetes. These are all treated with Atacand, Lipitor and Diabex. However, the patient admits to occasionally not taking his medicine in the last couple of days. Michael is allergic to morphine in the form of a rash. He is a heavy smoker and drinker and has a family history of type 1 diabetes and ischemic heart disease. Upon our first OBS, we've noted that Michael had a heart rate of 80, normal sinus rhythm, and this was confirmed on the ECG strip. BP of 140/85, but currently 130/80. Resp rate of 26 with nil efforts, now 16. Clear chest sounds with left equaling right and air entry to the bases with no adventitious sounds. GCS was 14 due to confusion, but is now 15. Temp 36.4, his BSL was 6.2. O2 stat was 93 on room air. We've delivered 4 litres of O2 via nasal prongs, and this increased his O2 up to 98%. On arrival, he was pale, moist and clammy, but is now adequately perfused, and his eyes are pearl. We've treated him with O2 therapy via nasal prongs, 4 litres per minute, and we've also given him 25 micrograms of fentanyl via IV access, which reduced his pain from 5 out of 10 to 1 out of 10. Patient requires further assessment, such as a 12-lead ECG, as we suspect possible cardiac issues. Thank you. I will now give you a hospital notification. We have Michael Creed here. He's a 56-year-old male, lives alone independent living. Michael had a full loss of consciousness unknown time, post-acute dizziness and a syncope episode. He woke in the hallway, slumping over, clutching his left arm. Hematoma found on posterior of the head, radiating pain down his left arm, rated 5 out of 10. Patient has a previous history of hypertension, non-insulin dependent diabetes, hyperlipidemia, and a family history of insulin dependent diabetes, ischemic heart disease, and patient is a heavy smoker and drinker and is allergic to morphine in the form of a rash. OBS, heart rate of 80, BP of 140/85, now 130/80, resp rate 26, now 16 with nil resp efforts, left lung equals right, air entry to the bases, no adventitious sound, GCS 14, now 15, temp 36.4, BSL 6.2, eyes are pearl, and O2 93% on room air. 4 litres of O2 via nasal prongs was delivered and increased this to 98%. Patient is receiving O2 therapy, and we've given him 25 micrograms of fentanyl via IV access. Estimated arrival time is 5 minutes. Thank you.